Welcome again, everyone, to this Prevention Collaborative webinar. Thank you for joining us. My name is Ruti Levtov. I'm a Senior Associate with the Prevention Collaborative, and I'll be moderating today's conversation. This is, as I mentioned, the second in our series of webinars on the intersection of violence against women and violence against children. Next slide, please. So for those of you who may be new to the collaborative, we work to strengthen our collective capacity to design, deliver, and advocate for cutting-edge prevention programs that are informed by research-based evidence, practice-based learning, and feminist principles. Next slide, please. One of the core issues that we work on is the intersection of violence against women and violence against children. As many of you know, there's increasing recognition that violence against women and violence against children share common risk factors, common harmful consequences, and that they're linked through these intergenerational cycles of violence. One of the things they also share is common promising approaches to their prevention. So often programming that can prevent violence against women can also prevent violence against children. And our focus today is really to understand better in practice what that means. What does it take to actually implement these kinds of programs? Next slide, please. So today we're going to have actually a conversation with some colleagues that are representing two programs. We have colleagues from ICS's Skilful Parenting Programme, who have been on a journey together with the Prevention Collaborative to integrate gender and violence against women into their existing strong parenting and child violence against children prevention program. And we'll also be talking with some colleagues who are now at the Prevention Collaborative about the Indashyikirwa program in Rwanda, which was really focused on prevention of intimate partner violence. And it's a couple, and this is mostly a couples program, but that had both impacts on violence against children and had integrated content about it. Next slide, please. So before we get started, a few webinar housekeeping details. This webinar is being recorded and is going to be shared over email. We will have some time, so this will be a moderated conversation, but we will have time for questions from you all at the end. Please type in your questions at any point into the chat box, but do make sure that the questions go to all the panelists and the attendees so that we can, so that everyone can see and maybe comment, and also feel free to share your own experiences or reflections in the chat box. And during the question and answer period, please raise your hand also if you prefer to ask your question kind of live. I think those are all of the housekeeping information. If you have any technical assistance issues, we're also posting a link in the chat on what you might do if that happens. All right, so thanks everyone, and let's get started then. We'll start with ICS. Can you go back one slide, please? Can you go back one slide, please? Thank you. All right, so ICS-SP is an innovative and African NGO that works with families, communities, and other stakeholders to create safe and nurturing environments for African children to reach their full developmental potential. Skillful parenting and ending violence against children is the core of their work, and their programs are typically embedded in economic empowerment and agribusiness programs that provide some of the livelihood support that is necessary. We have today with us Beatrice Ugutu, joining from Nairobi, who is the director of ICS-SP and the co-founder of the Parenting in Africa Network, and who has extensive experience developing solutions and inspiring actions to create these nurturing environments. We also have with us Maureen Ochieng, who is the program coordinator at ICS, supporting work in Western Kenya. And you can see their longer bios here on the screen. And so now let's talk a little more. Next slide, please. So Beatrice, can you tell us a little bit briefly about the Skilful Parenting Program as it existed before this kind of integration process?
Thank you, Ruti. Thank you, the Prevention Collaborative team, to invite us to this webinar to share our experiences. And today we are going to narrow down to the Skilful Parenting Program. It was developed in the year 2012 with a goal of promoting positive parenting practices and family relationships, with the ultimate goal of preventing violence against children and promoting children's positive development. This particular program has several components. Next slide. And the components are all geared towards supporting and ensuring that the home environments for children are safe and children are able to not only survive but thrive. So the model consists of an evidence parenting training that is delivered through group intervention, where parents and caregivers come together in groups of 18 to 24. Connected to that is the larger, to target the larger community, we do awareness raising sessions through community debates and dialogues on a number of topical themes in parenting. We also link families and caregivers to the required social support and essential services that are available within their communities. And as Ruti had mentioned earlier, this program is also embedded in economic strengthening interventions to address issues related to poverty at the household level. This program, as it was designed initially, is targeted at caregivers with children aged 0 to 18 years of age. It is delivered by local facilitators. This includes ICS staff, but also government frontline workers who are trained on the Skilful Parenting methodology and are certified to deliver the same at community level with parents. The program consists of 10 modules, which I'll share later on, and each module is delivered once a week, and we engage with parents for a period of 12 to 14 weeks. Each module is 3 hours in length. And in certain instances, we also link the parenting program with interventions that we do in the school settings. In terms of modules, we have 10 thematic modules that are delivered to parents and caregivers. This includes family relationships, roles and responsibilities of a skillful parenting, where we also address issues of child developmental stages and what parents can do at each stage to stimulate development. We talk about mental health, self-esteem and self-care, issues of values and nonviolent discipline, communication, understanding abuse, neglect, and exploitation. We have modules that address issues of family budgeting. And recently, we have also adapted the program to include topics to do with early stimulation, especially in the context of our ECD interventions. We also have now modules related to nutrition, and for parents who are reintegrating children back from children's institutions, we have added a module on building strong and secure attachments. And most recently and ongoing, about to be finalized, is the integration of gender and IPV in partnership with Prevention Collaborative. Ruti?
Thank you. And just very briefly, could you talk a little bit about the outcomes of the program? I know it's been evaluated a few times.
Thanks, Ruti, for the question. Indeed, we have evaluated this program. We have our own internal M&E data, but we have also collaborated with a number of academic and research institutes to be able to test the effectiveness of this intervention across the 3 countries where it's been implemented, Kenya, Tanzania, and Cote d'Ivoire. So primary outcomes that we've been able to experience include reduced incidences of violence against children, the significant reduction in the target communities, and specifically within the families targeted, where we have seen significant reductions of VAC. There's been increased positive parent-child relationships and communication. There's been the reduced support of and use of nonviolent discipline techniques. Important also for us was the improved relationship between the spouses or the parents and caregivers, which speaks to our motivation to be able to integrate aspects of violence against women within this VAC prevention program. And we have also seen increased household income and assets as a result of embedding this program in economic interventions. For secondary outcomes, we have experienced increased demand and utilization of basic services. So as parents become aware and conscious of their roles, they are increasingly reaching out to service providers to access services related to birth registration, nutrition, health, child protection, and many others that they would need at family level. We have also seen reduced incidences of family separation and more improved planning for family resources. Ruti, over.
Thank you. That was a very impressive list, and I think really speaks to what you say in your mission around kind of creating a nurturing environment for children. So picking up on what you said and focusing in, really on this intersection of violence against women and violence against children, could you talk a little bit about what your motivation was, in fact, for starting this process, which, as we'll learn later, was an intensive process of integrating IPV and gender into your already very successful existing program?
Thanks, Ruti. There are quite a number of issues and experiences that motivated us to integrate IPV prevention in the parenting program. One, if we look at our VAC survey studies, witnessing violence for children is a form of VAC, and that has become more pronounced in the violence against children studies that have been conducted in the various countries. So this for us was a great motivation. The environment against which children live and thrive is really affected by issues of domestic violence. So this for us was a big issue, and we needed to see how to be able to tackle this. Second, as I've mentioned from our results, there was anecdotal evidence around the effects of the original program. We have seen improved relationships between the caregivers themselves, improved self-care, improved communication, and all these factors really reduce the risk factors associated with partner conflict and violence. And we felt then we need to enrich our curriculum to be able to concretely address these aspects. And then, as you had mentioned in your introduction, globally, there's increased awareness on the intersections of VAC and violence against women, and there are promising interventions that have combined both that have generated quite a lot of impact. So this was quite an inspiration. And therefore, for us, we felt it is a greater opportunity to have a multi-layered solution or program that addresses both VAC and VAW instead of having this parallel. It would be more costly to have them parallel. So we felt like having them together, multi-layered, bundling them together was a cost-effective way in addressing these common risk factors for both VAC and VAW.
Mm-hmm. And so, once you had this kind of motivation, what were the next steps? Just briefly, sort of, what did you do? I think a lot of us kind of come to this realization, but don't necessarily take it forward in our programming.
Yeah. So we delved deeper into the implications of the research recommendations that were advanced by the University of Oxford, Glasgow, and our own local universities, and tried to ask ourselves, so what next and how? We needed to identify a technical partner who would support us in this adaptation process. And the key considerations that we made in terms of identifying the right partner would be a partner who's experienced in both VAC and VAW intervention. They had credibility and expertise around the issues of VAC and VAW and the intersections of both. Contextual knowledge was also key for us. A partner who had worked in our countries of operation, they understand what the contextual issues are, what the challenges and what the opportunities are, and what are the social norms that really surround the issues of VAC and VAW. And then their availability and accessibility to be able to work with us this journey, because then we wanted to build our capacity much more deeper in the areas of violence against women. So we were looking at both building our capacity and in the process being able to enrich our content or integrate VAW aspects within our particular content. So the proposed methodology was also quite key. So amongst the partners that were available, Prevention Collaborative fitted our eligibility criteria. So we were able to agree together with them take them through our program, our requests in terms of what we needed to do in the adaptation process. We agreed on goals, objectives, and processes, signed the MOU, and the work started. Interestingly, in the proposal that they shared, that you shared with us, was an accompaniment process. You know, sometimes we've participated in technical partnerships where there's a one-off capacity building workshop that addresses the theme of discussion, but in this place, it was much beyond that. Understanding us as an organization, being able to understand what we want to do and accompanying us. It's been a journey of about 18 months, getting to understand the organization, the program, our aspirations, what we need to include, and building our capacity in the process. And in so doing, we started off by identifying globally what were the evidence-based interventions that had integrated both VAC and VAW within their programs. We did a mapping exercise to understand where VAC and VAW intersect in our countries of operation. We relooked at our skillful parenting theory of change, because for us, it was much more than just adding an extra module in the curriculum. It was relooking at the different aspects of our curriculum and seeing the opportunity to integrate most aspects. Remember, we've talked about the risk and contributing factors for both VAC and VAW being the same. So we saw opportunity in every other module in the program to integrate the right gender and VAW aspects. So a review of a theory of change was quite critical from the beginning. And then now we had to work on a work plan in terms of how we will build our capacity on VAW, how we will relook at the different modules, agree on what needs to be included and what needs to be removed. So it was a 18-month-long process that, of course, involved quite a number of team members within the organization. For me, it was quite critical that the entire team gets involved in the process. One, to enhance their capacity, two, to get their and for them to be able to bigger team being involved in the beginning, but as we...
Beatrice, we're losing you a little bit.
Thanks, and over to Ruti.
Okay, we lost a few of your last words, Beatrice, but you'll have a chance to jump in again. So now I'd like to ask Maureen, who was one of the key participants in this long process, about what sort of surprised you about the process. What was different than what you expected in terms of what was needed to integrate gender and violence against women into your program? Over to you, Maureen.
Thank you, Ruti, for that question. Yeah, so we won't say that it was all easy as we'd anticipated. Sometimes when you hear the process adaptation, all we think about is an all easy process, but that was not the case for us. We had to ask ourselves so much questions in terms of what are the costs that are involved, but also just trying to ask ourselves, are we going to just modify the content that is already existing, or we may need to subtract from it, and what did that mean for us? So we also thought about, is it important for us to really adapt these? Because once you get into this and then you start asking yourself, oh, wow, okay, so this is what it is about. Also, as we started going through the process, there were questions around, so are we knowledgeable enough to handle this? Because then we realized at this point that it was just about us and all the activities and adaptations from the mentorship, and then the team had to be involved in doing most of the adaptation work. And so just realizing that, do we need to have internal capacity to do this first before then we get into doing the actual work? And also we got into it, and then we realized that it's not just a matter of removing certain sections of the module that existed and adding. It was a lot of work that involved looking into the module, finding out what content needs to be adapted and where do we put it into our existing modules. So again, that was not easy because it calls for discussions. And then upon that, we realized that it had also an implication on the time that is assigned for every module, because like Beatrice mentioned, our sessions run between 2.5 hours to 3 hours maximum. But then we realized that for that component that we are adding to fit in adequately, we needed to also figure out what is it that we need to retain from our existing content, or what is it that we need to remove to create room for the IPV component that we intended to integrate. And then also something that we also ask ourselves is, well, so this changes the whole content about the ICSSP, and which is as already presented and said that this was already evidence-based, it was evaluated, and there were results that we obtained. And so when we add up this content, that also means that it will be a new content that we have, new modules. And so we need to evaluate our component again. And also issues of copyrights. Somehow we realized that some of these IPV components that we were adapting would then be borrowed from, already programs that have been tested and found to be working. So what did that mean for us? And of course, we also talked about having to rework again the theory of change and all that. So that really meant a lot of work for the team. And at this point, I would wish to say that it was not possible to do it with the whole team. And so we also realized that to move faster and to be effective, not everyone could be involved. So there was a lot of dedication from a part of the team and not everyone, so that we're able to be effective and to move faster. So yeah, so those were a bit of the surprises, and we could be sharing some of these as we move along. Thank you, Ruchi.
Sorry, I was muted. One of the things that to me is really striking is how intentional this process was for you all. The different steps you're taking and the surprises or discoveries of how much it actually takes to adapt the program, but that is in fact is possible. Let's talk a little bit more about, some of the things you mentioned are in fact some challenges that you faced. Let's talk a little bit more about those challenges and any resistance, if you had any, to kind of changing the program.
Okay, thank you, Ruchi. So once we reach an agreement that yes, integrating the VAW component is very necessary and it's a path that we have to take. Then there was the discussion around just being keen not to lose on the original content that we already have. Because remember, like we already mentioned, this was contextually accepted by the community, what we had initially as a component. And then we also had it, tested and tried and evaluated. And so just trying to ensure that we do not lose that content and constantly questioning the adaptation and just saying, are we having too much of, VAW than the VAC that it was intended to mean? And so what does that mean for us? Yeah, about resistance. So at that point, we really felt that we don't want to have too much of the VAC components. And so we want to stick to what we are familiar with. You all know change is not very easy. So just having also the content as it is, and also having the curriculum structure, the format as it is, were some of the things that because the manual that we have that you're currently using, there's a way we used to facilitating using it, and adapting some of these then meant a totally new format and structure and even content. Yeah, but also as we went through, we realized that commitment in terms of staff time and of course the organizational staffing challenges, those are some of the challenges that we realized, because besides the adaptation that we later realized involved really a lot of work and required a lot of commitment, then there was need to dedicate time to enable this to happen. And that did not come easy, because staff have the projects that they're supporting and they need to ensure that they deliver on the objectives and the targets, but then there was also need to create time to work on this. And so we're saying it's taken as a whole 16 months to undertake the adaptation against other competing priorities. And remember, we said, when British said that there's an MOU that was signed, and so this engagement was time bound, And so it required really staff to be very flexible, sometimes working beyond the hours that we're supposed to work to just ensure that we deliver on these. Something else that I want to talk about is we had to make a choice. If you're going to, have this new content to include them content, what did that mean for us? Did it mean that we are going to have a longer module than we'd required? Because you need there's a minimum and there's a maximum time for every session to be delivered, and also the number of times you're supposed to meet caregivers when delivering a training. And so really finding that fit for us was another challenge, because we needed to find alignment. We needed to also ensure that we have a lot of fidelity to the core components. We needed to also discuss some of these adaptations, even as we adapted some of these activities of the VAW that are proven to work. We had to also relook and realize, is it culturally, does it fit within our context? And then realize some of our activities that we adapted could probably not fit. And so that called for looking into this activity, discussing it, and ensuring that whatever we adapt, do we make modifications that then will make it fit within our context? And then also whether to add a separate module, or if we felt that the integrated modules were sufficient enough. So we had to agree if you're going to add another module to just ensure that it comprehensively covers issues of VAW. And what did that mean for us? What did we have to drop? What did we have to consider as core components? So that was not also easy. But also beyond engaging the entire team in the process, we had to also, like I already said, have a small team to fast track. And also arriving at that team and, involving in the curriculum right workshops, and also even agreeing on time. It was not easy, because you understand that with our mentors, we have different time zones. And so ensuring that we work on the assignment and finding time that works for both of us, that really called for a back and forth, but we are glad that we got to where we are right now. And yeah, of course, working with the community facilitators to provide us with this feedback and how they take it, they're also used to the original module that we had. So what did that mean for them? We also had to ensure that now we have to retrain them, then involve them in, the new adapted module, so that they're able to share that also with the parents. So we agreed that even as we adapt, then there was also need to start testing it whenever an opportunity arises. And those were two things that we're doing at the same time, and it wasn't easy. So yeah, so those are some of the challenges that I will talk about, Ruti.
Thank you so much, Maureen. I think we're hearing about these big conceptual questions that you have to kind of address, right? And in some ways sort of re-socializing your staff and the people you work with to see these changes or to take them on. And we'll move on now to talking about Indashyikirwa, but we'll come back to this. But I just wanted to mention that in another context, one of the ICS colleagues talked about, having initially some skepticism around this intersection of violence against women and violence against children. And then she said, but now it's my song. Like now she, after going through this process, is really sort of committed to it. So, I think that this process that you went through sounds like was a necessary part of this integration. Excuse me. Thank you both, and we'll be coming back to you with some more questions. So next slide, please. Here you have some contacts. And next slide now. Sorry, we'll put these up and share in the chat. So next, I'd like to talk about the Indashyikirwa program and to introduce Dr. Erin Stern, who's a senior associate with the Prevention Collaborative, and she actually coordinated the impact evaluation of Indashyikirwa in Rwanda and also led the qualitative evaluation across the What Works to Prevent Violence Against Women and Girls portfolio, as well as Rita Nyaratunga, who's also a senior associate with the collaborative, who has extensive experience working as a practitioner in the field of violence against women and girls prevention, and especially working with couples and engaging men and boys for violence prevention. And Rita played an active role also in the design and implementation of the Indashyikirwa program, So welcome to you both, and looking forward to hearing more about how Indashyikirwa integrated content on violence against children and the impact that that had. So very briefly, if you could describe the program itself for those who aren't familiar with it. Rita, please go ahead.
Thank you, Ruti. Greetings to all of you. Talking about Indashyikirwa, can you hear me? Okay.
Yes,
so Indashyikirwa program, also referred to as the Agent of Change, was a 4-year intimate partner violence prevention program that was funded by DFID, Rwanda, and implemented from 2014 to 2018 by a consortium of 3 organizations in Rwanda: Kea International, Rwanda Women's Network, and Rwanda Men's Resource Center. It was implemented in 3 out of the 5 provinces of the country: the Northern Province, Western, and Eastern. And the targeted populations or communities were predominantly in rural areas. If I talk a little bit about the goals of the program, the expected impact was that Rwandan communities free themselves from GBV through relationship level change and an enabling environment. So the program had 4 main objectives, and I'll go very quickly through those. It aimed at empowering individuals and foster nonviolence relationships. It wanted also to shift harmful social norms and promote community action on GBV, and to create a supportive environment for activists, and to generate new evidence on how to prevent and respond appropriately to GBV. So GBV, in the context of Rwanda, I started talking about this being an IPV program, but these terms, you will bear with us, they are used sometimes interchangeably. Now, what were the key components? If I went into the components, I'll say that the program had 4 main components. There was a couple curriculum, which we'll talk about in details. There was a community activist, there was women safe space, and training and engagement of opinion leaders. I'll talk about the implementation. It was at 2 levels. So when I talk about the 2 levels of implementation, I'll start by clarifying the structure of the country, so you know when I talk about where the implementation was. So the Rwanda as a country is divided into provinces. As I mentioned, the 3 provinces, there are 5 in total. Each province is subdivided into districts. Maybe the structure is the same in some countries. So the districts are also divided into sectors, and sectors into cells, and cells into villages. And these villages were the smallest entities where the program was implemented. So for your own understanding, the program was implemented at district and sector level, the upper level, where there was an engagement of opinion leaders and service providers. And when I talk about opinion leaders, you will understand all these groups and committees that play an influential role, like local government authorities, religious leaders, like, in some contexts, some elderlies and youth groups, all these, including police or, key service providers. So at district level and sector level, Indashyikirwa trained in each sector, like I said, sector and districts are bigger entities. It trained around 40 opinion leaders and service providers at the sector level. And this part was led by Rwanda Women's Network. They were trained and supported in carrying out actions to prevent GBV. So in their own services, in their own influential role, they were trained to support and carry out actions against violence. There was also established physical women's safe spaces where women's safe space facilitators, these are women elected actually by other women, were trained for 2 weeks equipped with key skills and knowledge on key concepts around gender, power, how to take care of victims. These women's safe space facilitators regularly organize discussions at the physical women's safe spaces, and they developed and implemented advocacy messages, including sometimes use of media for advocacy purposes. They were also providing referral services, and they organized monthly review meetings with key stakeholders there to see how they can handle the GBV cases. Just for your information, there was one physical women's space at sector level. We understand it wasn't big, enough for all the communities, but these were accessible spaces where women and men could go for this type of support. The facilitators also, women's space facilitators, also conducted community outreach activities and home visits to families, especially that were experiencing conflicts. The other level of implementation was at village level, which is like the lowest entity at community level. So there, the intervention focused on couples training and accompaniment along with community mobilization. So a total of 840 couples recruited mainly from the CARES built village saving loans associations that many of you would be familiar with, the VSLAs. These individuals were taken through an intensive participatory 5-month couple training with a total of 21 sessions, and they were really going through foundational concepts around power, gender, rights, managing drivers of violence, etc. And they also talked about their sexuality. And in the end, they introduced the activism. That was going to be the next part. So this was done by 25% of those who were trained.
Rita, sorry to interrupt you. Just to, if you can wrap up quickly, so we're going to focus more on the people's curriculum.
Great. So I was saying that the next part that was going to be activism, which was going to be, the continuous actions against violence, was the program trained 25% of the total of those who went through the couple curriculum to now be able to conduct these activities later on. Over to you, Ruti.
Thank you, Rita. And Erin, since you were involved in the evaluation, can you tell us a little bit about the evaluation outcomes and particularly on what you found related to violence against children? That's the next slide.
Could you go to the next slide, please? So I'll quickly talk about, this Indashyikirwa was evaluated as part of the What Works Prevent Violence Against Women and Girls program, the DFID UK funded program. And there was both the randomized control trial and qualitative and process evaluation accompanying this intervention. There were two actually separate RCTs. As Rita's just explained, it's quite a complex intervention. And so there was the couples intervention that we evaluated as a randomized controlled trial between couples that just had the Village Savings and Loans Associations and then couples that had the VSLAs plus Indashyikirwa. There was a separate randomized control trial of the community activism or community level work, including the work Rita described, opinion leaders, safe spaces, and the activism component, which didn't have the same impact. And so today I'm just focusing on what we learned from the couples curriculum. And for our talk today as well, we've done kind of secondary analysis on what, in particular, the couples curriculum component means for preventing violence against children. So just to clarify that. But the randomized control trial did find that the couples curriculum significantly reduced women's experiences of multiple types of violence, as you can see in this slide. And although a reduced IPV within an intimate partner was the focus of the evaluation, we did include children's exposure to parental violence, so kind of witnessing violence amongst their parents, and also their own experience of harsh physical punishment as secondary outcomes. And did find that among women who reported physical or sexual IPV, that women had lower odds of reporting that their children witnessed IPV as compared to women in the control group. So we did see that less children were witnessing IPV on behalf of women's reports. And the evaluation also found that women who received the intervention and men reduced their endorsement of physical discipline in raising children. If you want to go to the next slide, this just also looks at the benefits for men as well. We found similar benefits for both men and women. And you can see corporal punishment of children went down. So parents in the intervention also reported, both men and women, a significantly reduced frequency of smacking or beating children in the home compared to the control group, as kind of asked for in the randomized control trial. We also have some qualitative research, quite extensive, that confirms these findings. And what we will then share today, and what we then did, was really look at some qualitative research on how and why the couples curriculum was found to also reduce violence against children, given that this was really a secondary, kind of more exploratory outcome of the overall intervention. So I won't talk too much more about the evaluation. I will share a paper for those who want to read more about these impacts.
Thank you, Erin. If we can go back a couple of slides, just so you're not looking at numbers the whole time. There we go. Thank you. So as Erin, you said, this was a secondary focus for the Indashyikirwa program. It was not the same kind of process that we heard from Beatrice and Maureen. Yet you see that there, even though there wasn't a lot of emphasis on violence, on preventing violence against children, you did find impact on this. So Rita, can you tell us a little bit more about how violence against children kind of came up in the program? Where was it discussed? Where did you include it? Those kinds of details.
Thanks, Rudy, for the question. So like Erin said, although Indashyikirwa did not explicitly target parenting practices as a program outcome, the couple curriculum offered a good wealth of examples and take-home activities to encourage participants to apply the learnings to their children and the whole family well-being. For example, couples were asked to reflect on the consequences of IPV for children and to consider what observing violence might teach their children about relationship between men and women. That was one example. So the sessions on gender roles particularly encouraged participants to reflect on what messages they were sending to their children about the relative values of girls and boys in the families. There was also a focus on rights of children, and these were explicitly discussed, including the 1994 Inheritance and Succession Law in Rwanda, which grants equal inheritance rights to male and female children of civil marriage. So you understand that there was some content already talking about how to prevent violence against children. Something else I would say is that participants were asked to consider benefits of reduced IPV for families and communities, including the quality of parent and children relationship. This is something participants valued a lot. I know some cultures don't really give that much time for men, especially in a couple, to take care of children. And this is something that after going through the curriculum, male participants enjoyed more. So in addition, the sessions on communication and conflict resolution skills and the uses of positive and negative forms of power asked and strongly required that participants critically reflect and apply these relationship skills with their children, like spending quality time in families, male parents getting more and more involved in parenting roles. So I'll say in summary that both the structure and the content of the Indashyikirwa curriculum show an integrated VAC component, VAC prevention component content, even if it's not reflected clearly in the theory of change. Thank you, Ruti.
Thank you so much, Rita. And Erin, just building on that, from the research that you did and from the program learning, what were the mechanisms that seem to be kind of driving these changes in parenting behaviors and perceptions, ultimately leading to this reduction in violence against children?
Thanks, Ruti. So as Rita started to allude to, the curriculum had lots of examples and prompting couples to think about the consequences of IPV, not only on each other and families, but also on children. And some of the consequences that came up through the curriculum or kind of the reflection included things like children's development, their mental health, their food security, educational achievements. And that really considering these consequences was found in the qualitative research to really motivate participants to reduce both their use of violence, IPV, and also their use of harsh physical punishment against children. Related to this, some participants noted that they were motivated to change both their use of violence against intimate partner violence and violence against children through considering the benefits to children of nonviolent, more gender equitable households. And Indashyikirwa has a very strong kind of benefits-based programming of really thinking about the benefits to families of nonviolence. And as I think we're learning in the field, the importance of a benefits-driven approach to change behavior. So that was also found to be an important mechanism to this change. And as Rita mentioned, Indashyikirwa did not explicitly incorporate parenting skills. It's not like what ICS has described of really having this strong parenting emphasis. But interestingly, many couples still reported applying relationship skills that they learned in the curriculum, including things like conflict resolution skills, constructive communication skills, to also how they parented their children. And they also noted that applying these skills could improve their quality of relationships, not only among couples, but also with their children. Which is quite interesting. And again, Indashyikirwa has a very strong emphasis on skills and then taking these skills home and practicing them together in the home. And so there was really this trickle effect to not only relationship skills among couples, but to their children that they also lived with. Another area of change to note is that the program did encourage men to take on more domestic and caregiving responsibilities, both as a way for kind of more equitable gender roles to potentially mitigate conflict or IPV. But this in itself could foster strong connections between fathers and their children, as reported by some of the men and women who participated in the curriculum. And some men also reported that reducing their perpetration of IPV and or violence against children and also being more involved as active caregivers led to improved quality of relationships, not only with their partners, but also with their children. And I think this really highlights the value of outlining, again, this benefits-based approach to men's role as more active caregivers and fathers. And men taking on domestic and care roles more traditionally done by women or girls was also noted to model alternative realities for their children and could help shift dynamics in terms of the roles that boys and girls were encouraged or expected to take on in the household, which was another kind of interesting impact that we weren't necessarily expecting through this program, but was something that came up from many couples. Several men also reported greater ownership and responsibility in caring for their children, and this was said to take potentially some onus off of women and mitigate a very commonly identified trigger of conflict or violence arising from perceptions of women neglecting childcare duties or women being blamed for children's mistakes. So there was many kind of interesting examples of the ways that reducing VAC can also reduce IPV, or more active parenting can reduce IPV, and the ways in which, and as I think we're more and more interested in the field, and those, all of us on this call today, that reducing IPV and VAC really intersects and can reinforce each other. And finally, I mean, Rita mentioned that there was a lot of emphasis throughout the curriculum on promoting the rights of women and girls and providing opportunities for parents to reflect on how they were raised as children, on how they might be raising their own children. And this was seemed to be really important to help men and women mitigate son preference and discrimination against girls more broadly, and foster just more gender equitable parenting of their sons and daughters. Finally, I will say that, Indashyikirwa has a very strong emphasis on challenging negative uses of power, including power over, and challenging acceptability of violence that is linked to that, as well as harmful gender norms. And all of this seemed to be quite important to motivate changes in parents' use of harsh punishment against children, which was identified as a form of power over, and rather trying to apply more constructive conflict resolution skills with children, a skill that was really emphasized throughout the curriculum. However, the notion that harsh physical punishment could have a role in disciplining children persisted, and I think this just indicates the difficulty to shift very strongly embedded social norms, including the role of discipline and harsh physical punishment as a form of discipline that's sometimes necessary within these short programmatic timeframes.
Thank you so much, Erin. I think there's a lot to unpack there, and to think about really how these, how these different mechanisms sort of build on one another. Just very briefly, I guess if you were to do it again, or how could you more intentionally integrate violence against children into this program? What would that have looked like?
Thanks, Ruti. I mean, I think just building off of that last point, I think the curriculum could have more carefully articulated the negative consequences of harsh physical punishment against children. Again, the kind of consequences of IPV against children were reflected on, but not so much really thinking through the harsh physical punishment against children and those consequences. And trying to challenge this very dominant norm that was identified in Rwanda, I think is identified in many settings that we work in, that corporal punishment is effective as a form of discipline. So I think that's one key takeaway. I think the program could have also more explicitly provided opportunities for parents to reflect on gender discrimination of children and emphasize the rights and equal opportunities for women and girls, and promote more gender equitable parenting. Again, we saw this through the curriculum, kind of linked to building on examples of promoting the rights of women and men, or promoting kind of relationship skills, but I think it could have been applied more explicitly to parenting, and to particular how you parent your sons and daughters. I think the skills building emphasis, which was found to be really important, and also really important to foster the reductions in IPV, could have been more carefully expanded to include parenting skills, including things around how to discipline in more positive ways, for instance, and how to manage a child's behavior through nonviolent discipline. I know there's also some really interesting evidence around developing parents and caregivers' emotional self-regulation skills, and how that might look a little bit different than conflict with another partner. And so I think there could have been some more explicit content embedded in this curriculum around that. And yeah, I think overall the program did achieve quite noteworthy benefits for children, given that this was really a secondary exploratory outcome. But I think without more kind of explicitly emphasizing positive parenting techniques, the intersections of VAC and IPV more as part of the theory of change from the outset, the opportunity to really address both forms of violence was not as maximized as it could have been.
Thank you so much for those reflections. We're gonna skip a few slides now. If you can go next. There we go. We'll go one slide back, please. Here you can, you see a photo from some work of the Prevention Collaborative together with ICS. Before we move on to questions from all of you, we wanted to just ask one final question to both the colleagues from ICS and colleagues from Indashyikirwa, to close and to get us started. For you, what's exciting about this process? What do you see as possibilities for the field? Let's start with Beatrice, if you're with us.
Thank you, Ruti, for that question. I think a good positive experience for practitioners in this field is the ability to bundle together a solution that is able to tackle both VAC and VAW. It's cost effective. The targeting is the same. The contributing and risk factors are the same. So if you're able to combine them, and it has been proven globally that it's a proven practice when you combine both, and it's very cost effective, I think that would be very valuable. But also, again, that adaptation processes take time. And you have to really get the buy-in of not only your team members, but also the frontline, workers who are delivering these interventions, because then they have been delivering it in a certain way. New content or new way of doing things requires refresher trainings. And that means that you have to be very deliberate around, involving them in the adaptation process, but also refreshing their skills on what to deliver. And all this is delivered in the backdrop against certain predominant social norms that really still do affect those. So social norms programming in the implementation side. So in our community still remains that go parallel to VAC and VAW interventions to address the broader social norms in the environment. Yeah.
Maureen, is there anything you'd like to add?
Thank you, Ruchi. Yeah, so just to add to what Beatrice has said, that when we look at the two programs, violence against children, violence against women, it's very outstanding that the issue of co-occurrence is critical. And so like she says, there is need to program around both in order to tackle both issues. Because if you're talking about protecting children, then we cannot run away from, protecting the women who, as we realize in most of our contexts, as the first line caregivers, for the children. But also we realize that when we tackle this, then we're also able to bring in a male counterparts who are also in most cases the perpetrators, as evidence has it. And so it's also a way of just looking at the whole system in one program. So that's very key, yeah.
And Erin?
Perhaps also just to add, Ruti, just a second.
Sure.
Within the backdrop of our parenting program, it's quite important to ensure that the relationship between the caregivers is being resolved and that they're in harmony. There is
we lost you a little bit, but I think the thinking about caregivers being in harmony is a important aspect. Erin?
That parents and caregivers can be able to provide that support, that guidance to their children when the issues that they're going through have not been.
Beatrice, you're coming in and out, so I'll move on to Erin, but if you want to maybe add in the chat so that we didn't miss the point that you had. Erin?
Okay.
Thank you, sorry about that. Erin, and what's exciting to you? What do you see as the possibilities for the field?
Thanks, Rudy. And to me, I'm really excited about the potential of couples programming to prevent both IPV and violence against children and promote more gender equitable, entire kind of family dynamics. And I think, programs that work with couples, especially who live together. So this is a kind of a particular emphasis on cohabitating couples who live together and with their children. Seems that it can be very powerful as they can model relationship changes in the home and they can apply the lessons to their parenting approaches and use of household violence. So I'm quite excited about that potential. And I just think in terms of lessons for the field, I think it was really valuable that even though this was an IPV prevention program, that we assess the impact on children in the home and learn some important lessons about how to better integrate with violence against children. And so I think any IPV prevention programs continue to assess the impact on children, especially programs that work with couples, given that we know of this potential pathway. And similarly, parenting caregiver programs to really evaluate their influence on IPV. And I think this will allow us to better understand the intersections and identify programmatic possibilities to address both forms of violence simultaneously.
Thank you. Rita, any last additions around what do you find exciting about this and what's the possibility?
Just one thing. So I see there more than an excitement, I see a possibility. If a program that did not intentionally include all what we all mentioned could achieve that impact on children, I feel like this should be another, way practitioners in the field should see that there is really a need to work at the intersection and do it in a more thoughtful and intentional way. So, yeah.
Thank you to all of you. I'm going to add, just from my personal perspective as someone who's worked on this topic, that one of the things that I see is very exciting and has been reinforced by the conversation with all of you is how much the possibility for learning, all of these different mechanisms, how they reinforce each other, all the different options that we have in terms of new programming that can really address these two interlinked and epidemic level issues of violence against children and violence against women. So now we'll move on to some questions. Thank you for those of you who have been putting them in the chat. We'll start with a couple of, next slide, please. Mostly clarification questions. These are both came in early in the chat and are directed at ICS. Again, very complimentary of this, great to hear about the program. A quick question if the modules are available to share. This is a question from Rebecca Herman to Maureen or Beatrice.
Thank you, Rebecca. Yeah, Maureen, go ahead, sorry.
Oh, okay, sorry. Yes, so the modules are available for us to share. Yeah.
Great, thank you. So we can facilitate that. And there's a question here from Tandy, also clarification around the ICS curriculum, around whether there was any content on reducing parental alcohol or substance abuse.
Thank you for that question. There were questions around abuse, neglect, and exploitation, and we really did figure out the different forms of abuse, neglect, and exploitation, not necessarily narrowing down to alcohol abuse and substance abuse and what can be done to strengthen the protective factors and reduce some of the risk factors associated with violence, particularly alcohol and substance abuse.
Mm-hmm. But Tandy, just to say, I don't know if Indashyikirwa included some content on alcohol use, but another program that I was involved with, the Bandebereho program, also in Rwanda, did have just one session on that, but it seems to have been very important for reducing violence against women in particular. And just one more comment. If you prefer to ask your question out loud, feel free to raise your hand and our webinar team will point it out and unmute you to do that. But in the meantime, I'll ask a few more questions that came through. The first is from Fabio around the focus within the ICS program on, was the focus on corporal punishment by parents, or was there, other forms of violence also? So sexual abuse, dating violence, or child marriage, depending on the age of the children. So part of it is a question around what's the kind of target age of the children. And Maureen, do you want to answer that?
Thank you, Ruti. So the evaluation looked at all forms of violence. We believe that somehow violence against children are interlinked. And so whether we talk about physical violence, whether we talk about emotional violence, whether we talk about sexual violence, all these are violence against children. And so when you're implementing the parenting program, it seeks to address all these forms of violence. The approach here, we said it's skillful parenting. And so it seeks to support the caregivers to help them to parent better. And so when they build the protective measures for their children, they're able to protect them against all forms of violence. Yes, that's what I want to say. And of course, for the children that we working with, we consider all children that's between 0 to 18 years. Yeah. Maybe Beatrice, if you want to add something.
And just to say, there's a quick follow-up question there about whether in the evaluation.
No, well said.
Great. Thank you, Beatrice. Just a quick follow-up question. It sounds like then in the evaluation, you did look at different forms of violence against children as well.
Sure.
Yes, in the cultural acceptability study, in the randomized controlled trials we did with the University of Oxford, we looked at all forms of violence against children. Yeah,
great.
And the evaluation reports have been, and the links to the evaluations have been put in the chat box.
Excellent, thank you so much. All right, so let's dive now deeper into some, discussion questions. Some of these are also directed at you, Maureen and Beatrice. There's a question from Anik about whether you've looked at sort of a more developmentally sensitive analysis of the evaluation data, thinking about, whether parenting skills and needs may be different for younger children versus older children or adolescents. And that may be, based on the focus of your program, but just thinking about how the parenting content might need to change.
Sure, thank you, Anik, for that question. Definitely, yes. Within the overall curriculum, we look at the different developmental stages ages and what parents need to do at each development attachment. But at the same, based on the first evaluation results, early childhood care and development was a key recommendation in terms of enriching our content on the same. So we were able to add specific modules on early stimulation and nutrition. And we have been able to test the impact of the entire curriculum with children aged 0 to 8 years in Cote d'Ivoire, but also children aged 0 to 5 in Western Kenya, Bungoma County, on how this curriculum has been effective in terms of promoting outcomes at early childhood development level.
Beatrice, we're losing.
Other studies are in also for 0 to 5. Do you, Ruti?
I'm sorry, we're losing you audio-wise again.
Over to you, Ruti.
Okay, so we'll try to get more detail here. There's
Could
another.
I just add something, Ruti, before maybe we move to the next question?
Yes, of course.
Yeah, so about being age.
Maureen, you just muted yourself. Please go ahead.
Muted by the host. Okay, so about looking at different ages and parenting based on ages, then we realized that because in our programming, as we target different households, there's always the index child, you know, how we enter the household. But then we also realized that there are also other children. The caregiver could be taking care of more than one child. And so in the module on parent role and responsibility and even understanding the needs of the children, then that is broken down into, you know, how do you deal with a toddler? What are the children's needs and what do parents need to do? So that is broken down by age from, you know, 0 to 2 years, then, you know, into the preschool and then into the school going age and then into the adolescent. So what the child needs and what the parents should do. So that helps different parents, you know, who have children at different ages to be able to know how to parent depending on the ages that the children they're raising are in. Yeah.
Thank you so much. Let me ask another question. I think this is a really important question for all of us to think about. It's directed at Beatrice, but I think I'll ask others to weigh in as well. This is a question from Samuel. Are the parameters for assessing effectiveness of skillful parenting universal or transferable? That is, are there cultural differences in what's considered effective skillful parenting? Beatrice, I don't know if you're able to if the connection allows, if you want to respond there or maybe in the chat, or Maureen as well, if you have some thoughts on it.
Thank you, Samuel. Can you hear me? Is it better now? Great. Thank you, Samuel, for that question. Indeed, it has been a key question within the organization and work in progress over the years. So when we did the randomized control trial, we tried as much as possible to compare this program against globally agreed upon indicators on VAC prevention, on parenting. So those indicators have remained quite critical, even as we continue to evaluate our program beyond the randomized control trial. And we seek to ensure that our internal M&E tools are equally speaking to the global indicators around parenting, and also guided by the INSPIRE framework indicators that were shared in the recent past when INSPIRE was launched several years ago. So it's been quite a challenge for us as a local agency, but from the randomized control trial, there are very key indicators that we were able to pick from the ISPAN, you know, indicators, from the mixed indicator surveys that we continually, you know, use within our own internal M&E system. But it's quite critical for these results to be, you know, accepted also across regions. In terms of cultural issues, what we've had to consider the local definitions of what parenting means in different contexts. And I think from our experience, what we continuously realize is that beyond basic need provision, the other softer aspects of parenting are always left out in the different definitions locally of parenting. So we try as much as possible to, when we're talking about the module on roles and responsibilities of a skillful parent, we stress the fact that it needs to go beyond food, shelter, clothing, education, and healthcare to issues of love, attachment, play, which are equally important within those families. So it's quite important to do those cultural acceptability surveys to just ensure that the definitions you use, the concepts that you're promoting within and the methodologies you're using, you can know certain communities even involving men and women in the same parent peer groups or a couple session is not easy as well. We experienced that in Tanzania, where we've also had to have separate sessions for men to be able to take them through this curriculum. So those cultural acceptability checks remain quite critical as you roll out. And it's good to always check in even after adaptation, because then we add new concepts. Maureen had mentioned that we had to test the adapted curriculum with families as well to just ensure, and there are several activities that did not augur well that we had to do away with even after adaptation. So those checks remain quite critical. Perhaps Maureen can add.
Thank you so much. Maureen, do you have something to add, or should we move on to the next question?
Kindly, let's move on to the next question. I feel that's sufficient.
Okay, great. Thank you. Here's another question. This, I'd love to also hear in the chat perspectives from others. This is a question from Daniel Lima, who's writing in from Brazil, asking about raising kind of broad cultural awareness around violence against children. So in Brazil and in many countries, many people recognize that violence against women is wrong, and in some places it is in fact a crime, even though Daniel notes that it hasn't actually reduced rates necessarily. But they still see things like corporal punishment as educational, as important to discipline, as a right of parents, even though in some places there are in fact laws against violence against children as well. So just from your perspective, Beatrice and Maureen, working across several countries in Africa and maybe in other places, is there a way to, or what do we do about changing this perception of, which Erin talked about as well, about the use of corporal punishment as kind of a necessary for discipline?
Maureen, you want to go?
Sure. Thank you, Beatrice. So we realize that some of these issues are not just things that happen in a day. We probably grew up and we realized that, corporal punishment probably is the only corrective measure to be used, in children. And during our workshop that you were analyzing some of the social norms, we realized that some of these norms are promoted even by Bible verses. For those who are Christians, there are verses that say that spare the rod and spoil the child. And so there's so much justification around these. And of course, growing up with corporal punishment as the only corrective measure, then it becomes difficult for us because we grow up knowing that that is the only thing to do, And also we know how socialization happens when it comes to influencing how we behave and act. And so for us to change that, it doesn't just start at, policy level, because I know it's easy to say that let's develop policies around this area and implement, but that probably has not worked in most areas. So for us, what is key is, behavior change and attitude change. So we need to identify who are the perpetrators, and so start working with them to change their attitudes and change their behaviors. And currently, of course, that's what we are doing. We have an approach that we intend to evaluate as the whole school approach. And because you're working in the field of corporal punishment, so what you're doing is we want to see what are some of these interventions that if we deliver, then can lead to corporal punishment. So we're implementing matters life skills and also supporting the teachers to just know how do you reinforce issues of positive discipline? How do you understand your child? So the level where you understand developmental challenges, depending on how the child was raised, and so that the teachers who are, in the first line in terms of perpetrating corporal punishment, then are able to also know that, this is a child, these are how the child was socialized, and so how do I support when I'm talking about molding a child's behavior? But we also work with parents and caregivers because some of these things happen from home. And when we're doing an analysis on social norms and some of these things that are culturally accepted, then realize that the parents say, I was raised up, beaten, and that's how I turned out the way I am. So it is okay. So even the parents themselves justifying then becomes difficult. So for us in that particular intervention, where we target the caregivers to change their behavior, to give them alternatives, because the other thing is that probably you're told that corporal punishment is not right, but what are the alternatives? So also just supporting the caregivers to know that if we're saying that corporal punishment is not the ideal way of ensuring correctional measures are put in place, then these are the alternatives that you can work with your child on, and those we provide them based on the ages of the children. The way you would punish a 2-year-old probably is not the way, the way you'd correct, a 2-year-old is not the same way you're going to correct an adolescent. So, so we provide parents with alternatives on. So if you have a toddler, then this is how you're going to ensure correctional measures. If you're having an adolescent, then these are their behaviors, and this is how you're going to correct them. And of course, working with the teacher so that there's a sync between what the teachers know and what the caregivers know. And so, because at home, then parents are the perpetrators. In school, it is the teachers. So just working with these systems to ensure that everyone is supported to understand what is the situation, and also helping them with alternatives on what do they need to do. So I think for us, that's what we have been able to do, and we're still in the process of evaluating that. But Beatrice, over to you, probably if you could add something.
Thanks, Maureen, for that overview. I think challenging myths and misconceptions around violence against children and violence against women is something that requires patience from practitioners. It's not a 1 day, 1 week, 1 month intervention to be able to challenge these myths and misconceptions. And therefore, the community dialogue sessions and the community debating sessions around these things remain quite critical, and especially not having a confrontational approach. I think when you confront communities about things that they're doing wrong, then you already get defense mechanisms from them in terms of, no, it's not happening, or they hide it. And therefore, having a very open discussion around, why these things happen, around the beliefs that they have, especially as relates to corporal punishment, is quite critical. Because then asking very good reflective questions around, is it true that, corporal punishment is the only way that you can be able to mold the right kind of behavior in your child? And being that our intervention is delivered within the group approach using parent peer groups, then you find in those reflection sessions, parents say, no, for me, this is what I've been able to do with my child. I've never beaten them up, but they've been able to adopt certain kinds of behavior. I set rules and boundaries within my house. So those, reflections approach within the parent peer groups, within the community debating sessions are quite critical, instead of them seeing an outsider coming in to tell them how to do things, but actually the solutions are within themselves. So creating those platforms where they challenge certain norms that have been quite common within their communities, but being less confrontational with communities really helps a lot to have those conversations in a safe space where they don't feel attacked. That has worked out well for us. And then, of course, having champions within the community who can share their stories of change in terms of how they've been able to bring up their children. And lastly, within our curriculum, we talk about child developmental stages for parents to understand what to expect at each stage, so that they have
Thank you, Maureen and Beatrice.
expectations for their children, because sometimes parents thinking their children should behave in a certain way, while for that.
Beatrice, we're losing you again, so I'll move on.
Thank you. Bye. Over.
Thank you. I think so. So back to you, Daniel. I mean, that was a very rich response. It sounds like there's a need both to find ways to, in a positive, non-confrontational way, attempt to change these social norms, but also really focus on kind of the skills and the things that you need for, parenting and of children at different ages, right? So finding ways to address problematic behavior in children, or address behavior in children as a set of skills and competencies in parents. We're gonna switch gears a little bit, and this is a question for Erin. from Rosina about actually the research with couples. So violence against women guidelines suggest not interviewing men and women from the same households, but in different clusters for this to be done safely. Can you talk a little bit more about some lessons learned around safety for research with couples? I think we have other conversations that we've had on this. So very briefly, if you don't mind, Erin.
Yeah, I was just absolutely. And thank you for that question and that really important question. So I think there's lessons around the research and also the programming. I think they're quite similar in terms of how to do couples programming safely. And so with Indashyikirwa, and this applied to both the recruitment of couples who then went through the RCT, it was not recruited as an IPV program. It was recruited or kind of positioned as a relationship quality program and kind of coming in with a more benefits-based approach. And we think this was quite important, for not stigmatizing people of coming forward, like if they're going to volunteer to participate in a curriculum for being known to have violence, that could be very stigmatizing and could also be risky for women. So I think that was quite important in terms of this particular program and model. I also think one thing that we kept in mind in terms for safety was to recruit through the women first. And so women were firstly invited from the VSLA groups. As Rita mentioned, there was already this platform, this VSLA platform, which I think helped with kind of that trust, kind of care, approaching and speaking to women. And then if they were interested, they could invite their partner. And so that was something that was, again, applicable to both the research and the programming, that it was recruitment done through women. I think it's important to think about which couples we might then be missing, right? Because it's, a limitation. But one thing to keep in mind is there was very high levels of violence found in the baseline survey. So even using this approach, it still seemed to reach couples that could really benefit from it. And then another thing with the curriculum itself, it was really important, and we learned this through the pre-test, to have both a male and a female facilitator present, not only to kind of model gender equality in the classroom, but if men or women wanted some psychosocial support or wanted some one-on-one support, having the option to talk to a facilitator of the same sex if that was a preference, and also just equipping facilitators with psychosocial support skills and referral skills, because it could be a very kind of emotionally intensive process. There were also the women's safe spaces in the intervention communities that women or men could be referred to, known to experience violence or just wanting more kind of ongoing support. And a lot actually did end up reaching out to facilitators for support, which spoke to the importance of equipping them. I think that was actually something that could have been done kind of in advance. It was something, as Rita might share more, we did as we went along. But I think from the outset, when working with couples, it's really important your facilitators are well equipped with psychosocial or referral skills. And I think those are some of the key lessons. Also, really emphasizing to couples that nothing would be shared with their responses, but that they were both aware that they were partaking in these interviews and consenting to that, but making sure it was done separately, matching facilitators of the same sex, and emphasizing confidentiality among couples, because I think that takes a different level of consideration than if you're interviewing individuals. But we did find the couples interviews, when you go to the same couple, you can then look at analysis of what both partners say, and that can be an extra kind of element of rigor and just understanding really couples dynamics and change in response to this kind of program. So I definitely think those steps to do so safely are paramount, but it can also be really illustrative through interviewing couples, and as we've just saw, working with couples together through the program.
Thank you so much, Erin. We're not gonna get a chance to go through all the questions, so I'm gonna pose one fairly big one to both teams, actually. So Diana Arango from the World Bank is asking, what recommendations would the teams have when scaling the program? I know that these programs are still not at the national level yet, but what would effective scale up look like at a national level, for example? So let's start with Beatrice, please.
Thank you, Diana, for that question. Indeed, the issue of scale remains paramount for local organizations that are implementing evidence-based interventions. For us, it was more identifying the scaling pathway, and we did decide to look at government as one of the pathways to go to scale. And therefore, it was quite critical to understand whether there's a policy backing on the same at country level. In our case, in Kenya, there are quite enabling policies, and then we did the VAC survey. And then the country has developed the National Response Plan against violence against children. So these have provided very good opportunities to have these discussions with government. And critical to the evidence-based intervention is the identification of the core components that work for your program. Because if you're going to scale, it's a bit ambitious to think that the entire program could be taken up. So you have to do that extra assessment around what are the core components, communicate your evidence very clearly, and the investment required to be able to take this at scale. I know parenting is also a discipline that requires the engagement of many sectors in government. So the health sector, the children's department, the community development. So you have to find the right ministry to anchor your influencing efforts. Who would be the parent ministry with whom you collaborate, engage with, share evidence, bring them to experience what it means to implement in practice, and then use that to explore the infrastructure needed at national level by government to be able to do this. What has also propelled us in Kenya to be able to bring this program to scale, including Tanzania as well, is the transition to scale phase, where we tried to implement with a few frontline workers from government, the Ministry of Health. We worked with community health volunteers, and within the community, within the Department of Children's Services, we also worked with the volunteer children's officer. So testing it in practice with the government frontline workforce also gave us additional evidence around whether it can work or not, and what are the measures that we need to take into consideration. But the policy backing is important, the National Response Plan, and you agreeing on what are the core components of your program that can be brought to scale. Those were some of the aspects that we have been able to work on to bring the program to scale.
Thank you so much, Beatrice. And we're actually just out of time. So we'll have to wait and hear about Scale Up at a future webinar. If we can just move on to the next slide. Thank you to all of our panelists, and thank you to all of you, our audience today. You can stay connected with the Prevention Collaborative and hear more about these programs here on the slide and shared in the chat. And we also will be having a virtual coffee, which is a more informal conversation, discussion-based conversation next week on disability inclusion in violence against women, violence against children programming next week, Wednesday, exactly the same time. So if you're interested, take a look at the chat. And again, thank you so much for being here today and for continuing this important work on the intersections of violence against children and violence against women.